Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. I'm Wael Berro, your host for today, and I'm family medicine consultant at Emirates Specialty Hospital. Today we're talking eyes, we're talking cataract, and who's better than this than my new colleague, Dr. Anurag. Nice to meet you, Dr. Anurag.
Thank you. My name is Dr. Anurag. I'm a cornea, cataract and refractive surgery specialist with 11 years of experience in Middle East and 18 years in total. I recently joined Emirates Hospital Group and currently I'm working as a specialist ophthalmologist at Emirates Hospital, Motor City.
Very nice to have you over. And today I'm actually the medical student on your team because I admit, and I'm going to do it on the podcast today, eyes have always been my weak area of expertise as a family doctor. So I'm always happy to delegate my patients to you. What is cataract and what do patients have to be wary of in terms of symptoms? What do they notice and when they have to come to you for further treatment?
So the word cataract originates from Latin and Greek language. In both the languages, the meaning of a similar word is waterfall. The most common symptom that patient feels when they start developing cataract is clouding of vision, which is gradually progressive and painless. Cataract is basically opacification of the natural lens, the lens that we are born with. At birth, the lens is very, very clear, transparent. But as the patient ages, there is a lot of changes happening in the lens in terms of opacification of the lens proteins, and that leads to opacity of the eye, which further perceived as blurring of vision by the patient.
Thank you for the summary and definition. So the treatment, patients will start noticing this gradual deterioration in their eyesight. They come to see you, you examine them, you confirm they have cataract, and normally you recommend cataract surgery. What happens? What does it mean? And what do the patients expect?
When patients come to us with the complaint of gradual progressive loss of vision and we diagnose them as cataract, this basically is about embarking on a journey where we have to evaluate and select our patients who are eligible for cataract surgery. Not everyone who has cataract is an ideal patient for cataract surgery. It has to be either decline in the quality of vision or the amount of lines that they can see on the chart. That decides how advanced their cataract is, and based on patients' needs, we decide whether they are the right candidate for cataract surgery or not. It also involves evaluation in terms of their general health. You are a physician, as you know that we need to take care of a lot of other parameters into account before selecting any patient for any surgery. And we also have to do a very thorough comprehensive eye evaluation, which includes patients' vision checkup, their refraction, their eye pressure, their retina examination, in general the slit lamp examination, corneal topographies, and other scans before we can choose them as the eligible candidates from cataract surgery.
Fair enough. So not everyone with cataract will end up with needing a surgery, and also not everyone who needs surgery might be suitable based on their medical conditions, like
Absolutely.
you said. But of course, it's a procedure, which means there are risks. Nothing in life is without risks. What are the risk factors or the potential risks associated with cataract surgery?
As you rightly said, no surgery or no procedure is free from risks. Cataract also comes with its own challenges. It's one of the most commonly performed surgeries, so people have mastered it. The machineries, the techniques that we use, they are highly evolved, but still there's a theoretical risk of complications. So the most common complication that we see in cataract surgery is infections post-operatively. We do see some corneal edema at the end of the surgery. We also encounter hemorrhages. We do have some issues related to the intraocular lenses that we implant. But these are all intraoperative and post-operative complications that we have to deal with. But they don't happen to all the patients that we undertake for surgery, but to a minuscule of patients.
And you mentioned that experience has gone much higher and people are expert, and I'm sure you said mastering the skill. So should I call you master?
You can.
Okay, perfect. So from your experience doing cataract surgeries, can you shed the light on how many procedures have you done and what's the success rate? And
Sure. So, as I told you, I have 18 years of experience in the field of ophthalmology, and I hail from India. So, the residency programs in India are structured in such a way that we embark on surgical journey pretty early during the residency. So, I did my first cataract surgery about 20 years ago, and ever since it has been a kind of very rewarding and learning experience. During these 20 years, I might have done a couple of thousands of cataract surgeries.
Very good. And I'm sure anyone will be in safe hands actually once they see you, and hopefully the outcome will be what they want and what they deserve. Of course, it's always worrisome whenever someone is going to do a surgery, especially when it comes to the heart. There's fear. As a patient, I'm coming to see you. I said, okay, we want to do procedure and surgery for my eye. I'll be scared, obviously. What are the process patients should expect? What are the preparations? And how do you handle that anxiety of eye surgery? I mean, I do remember when I was medical student, the first time I went into operating theater, you could see the eye staring at you, and it does look scary, I must admit.
Yeah. So, we at Emirates Hospital, we have a very patient-centric approach. The journey of cataract surgery can be divided into three parts: pre-operative, intraoperative, and post-operative. Now, the real art, the real science is in pre-operative evaluation of the patient. Now, when patient comes for examination and we find them to be a right candidate, I think the most important thing is setting the expectation right, evaluating their general health, medical conditions, take a proper history, know about their previous medical records and surgical histories. And after a thorough evaluation, we need to sit with the patient and do a kind of psychological counseling, what to expect post-operatively. That's very important to avoid the post-operative disappointment. So I think every patient is unique, everyone's need is different. So we need to have a very customized approach, which also includes depends on the profession, like whether patient has need for far vision, intermediate vision, near vision, whether they drive a lot, whether they are always in the office sitting in front of the computer, or they're a pilot, or they're just a homemaker, what kind of lens should be used, because there are so many lenses available in the market and every lens serves a different purpose. So all these issues are very important to be discussed beforehand so that we don't get any surprise post-operatively. Once we have selected a patient for surgery, then comes the evaluation in terms of blood tests, x-rays, cardiac evaluation if someone is very sick, or there's a pediatric patient, pediatrician has to clear the patient, or in case of elderly patient with comorbidities, family physicians, internal physicians have to clear the patient. And once the patient is fit, we call them on the day of surgery. Cataract is a day case surgery, so patients have to come on the same day, get operated, and go back home. When they reach to the hospital, that's where the actual journey starts. They register themselves, then the nurses will take their vitals. We have to be careful about their blood pressure on the day of surgery, the blood sugar levels, the cardiac status. If they are fit, then they go to the next step where we take their informed consent, which is also very important. Patients should know about the inherent risk associated with any procedure.
Of course.
So we explain everything to the patient, and once they agree, once they understand the risks involved and they sign the consent, that's when they enter the preoperative area where nurses dilate them and make the eye ready for the surgery itself. And then the actual surgery happens. So intraoperatively, it's a very straightforward procedure. We can do it under topical anesthesia. That means we just use the eye drops and don't give any injection to the patient. Some patients who are not comfortable with topical anesthesia, they choose to go for local anesthesia. And sometimes you have to choose general anesthesia for patients who are uncooperative or have some certain medical conditions, or pediatric patients. Once anesthesia is administered, this is a very straightforward surgery. We use a technique called as phacoemulsification, where we use a very refined ultrasonic probe, and this probe is used to break down the cataract within the eye, and then after breaking it down, it is sucked, and the bag or the lens capsule is replaced with an artificial lens, which restores the vision post-operatively. And once surgery is performed, finished, patient is sent to the recovery room, and there they take rest for some time. We explain them the post-operative medications. We also tell them the follow-up schedule, when to come, what to expect, and we also tell them very categorically that if they feel any untoward pain in the eye or sudden loss in the of vision in the eye, they have to report immediately. That's pretty much everything that we do on the day of surgery.
And that's an amazing way of summarizing the journey. And I love the part that you're focusing on communication from day one before the procedure. And that's very important, of course, because it empowers the patient, like you said, and then they'll be aware of all the steps. Now, you mentioned that as we get older, this issue, the cataract, will develop more. And we know that our population overall is getting older and older. So two parts maybe this question. First part is that, okay, I've done my cataract surgery, that's it, I'm set for the next 60 years. And what do you expect is going to happen with the aging population, that probably someone who operated on their eye at the age of 70, but now they're living for 90 plus?
Right. So before I take up this question, I want to clear one myth which is there around cataract, that cataract is the disease of aging population. This is true. Age is the most common risk factor associated with the development of cataract, but cataract can be seen at any age. In fact, there are infants who are born with cataracts in their eyes. Cataract can also affect younger population, which is happening these days more often because of the lifestyle diseases like diabetes, use of steroids, overexposure to radiations. So these are the factors that also have to be taken into account. Anyone who has any deterioration in the quality of vision is an ideal candidate for cataract surgery. Previously, because of limited resources or many other factors, cataract surgeries were being performed only for people who had advanced cataracts. But nowadays, it has become a lifestyle disease. Anyone who is not happy with the quality of vision, and if cataract is the only reason behind this deterioration of the vision, is an ideal candidate of cataract surgery. Now, once we have done this surgery and implanted a lens inside the eye, this lens is basically there forever. You don't have to change the lens. You don't see any further decline in the vision because the cataract has been taken out. Of course, sometimes some of the patients do develop something called as secondary cataract, where a membrane comes behind the IOL, but that's a very simple thing to tackle. We use a laser ND-YAG laser, which can clear the opacification in a matter of few seconds. So when you do the surgery, this is going to go with you. The results never decline.
Perfect. Very good. And again, thanks for this explanation. You see, I told you I'll be a medical student, so here you are. So it was a good question. Then even me as a doctor, I started assuming and fell into this trap. So thank you for clarifying this. Dr. Anurag, thank you very much. It was really enlightening chat about cataract. Any take-home or summary take-home message you want to tell our listeners today?
The take-home message which I want to give to our listeners is that whenever you feel any gradually progressive decline in the vision, do visit your ophthalmologist and don't self-medicate yourself. It may be a cataract developing, and it can be cured very easily if detected on time and done in expert hands. The surgery is very straightforward. The downtime is very less, and that's all I want to say. Thank you.
This brings us to the end of our episode today. Thank you very much for listening, and stay tuned for a new episode of Al-Majlis podcast by Emirates Hospital Group. Thank you very much, Dr. Anurag.
Thank you. Thank you so much.